Cystic fibrosis, a respiratory system disorder. Highlight in blue information that matches Alexandria's case. Highlight in red items that do not match Alexandria's case. What is cystic fibrosis? Cystic fibrosis is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive tissues. These secreted fluids are normally thin and slippery, but in people with cystic fibrosis, a defective gene causes the secretions to become sticky and thick. Instead of acting as a lubricant, the secretions plug up tubes, ducts, and passageways, especially in the lungs and pancreas. Although cystic fibrosis requires daily care, people with the condition are usually able to attend school and work and often have a better quality of life than people with cystic fibrosis had in previous decades. Symptoms. Cystic fibrosis signs and symptoms vary, depending on the severity of the disease. Even in the same person, symptoms may worsen or improve as time passes. Some people may not experience symptoms until adolescence or adulthood. Most of the signs and symptoms of cystic fibrosis affect the respiratory system and digestive system. However, adults with cystic fibrosis are more likely to have symptoms such as recurring bouts of inflamed pancreas, infertility, and recurrent pneumonia. Respiratory signs and symptoms. The thick, sticky mucus associated with cystic fibrosis clogs the tubes that carry air in and out of your lungs. This can cause symptoms such as a persistent cough that produces thick mucus, wheezing, breathlessness, exercise intolerance, repeated lung infections, inflamed nasal passages, or a stuffy nose. Cystic fibrosis continued. Respiratory system complications. Damaged airways, bronchiectasis. Cystic fibrosis is one of the leading causes of bronchiectasis, a condition that damages the airways. Chronic infections. People with cystic fibrosis may often have sinus infections, bronchitis, or pneumonia. Growths in the nose or nasal polyps. Coughing up blood. Hemoptysis. Pneumothorax. This condition in which air collects in the space that separates the lungs from the chest wall. Pneumothorax can cause chest pain and breathlessness. Respiratory failure. Over time, cystic fibrosis can damage lung tissue so badly that it no longer works. Digestive signs and symptoms. The thick mucus can also block tubes that carry digestive enzymes from your pancreas to your small intestine. Without these digestive enzymes, your intestines aren't able to completely absorb the nutrients in the food you eat. The result is often foul-smelling, greasy stool, poor weight gain or growth, intestinal blockage, particularly in newborns, severe constipation. Digestive system complications. Nutritional deficiencies. Their body can't absorb protein, fat, or fat-soluble vitamins. Diabetes. Around 30% of people with cystic fibrosis develop diabetes by age 30. Causes. The cystic fibrosis, a defect, mutation, in a gene changes a protein that regulates the movement of salt in and out of cells. The result is thick, sticky mucus in the respiratory, digestive, and reproductive systems. Children need to inherit one copy of the gene from each parent in order to have the disease. If children inherit only one copy, they won't develop cystic fibrosis. However, they will be carried and possibly pass the gene to their own children. Cystic fibrosis continued. Below are the common signs and symptoms of cystic fibrosis. If Alexandria experiences this sign or symptom, drag it over to the purple box. Common signs, symptoms of cystic fibrosis: exercise intolerance, persistent productive cough, wheezing, poor weight gain and growth, greasy stool, severe constipation. Alexandria shows these signs and symptoms of cystic fibrosis. How is cystic fibrosis diagnosed? In most cases, CF is diagnosed during childhood. Doctors diagnose CF with a thorough evaluation and by using different tests. These include genetic tests. These are performed using a blood sample that is tested for the faulty genes that cause cystic fibrosis. Chest X-rays. X-rays of the chest are used to support or confirm cystic fibrosis if a healthcare provider suspects that a person has the disease. Other forms of testing need to be used to confirm the process of cystic fibrosis. Lung function tests. The most common lung function test uses a device called a spirometer. The patient breathes in completely, then empties the inhaled breath into the mouthpiece of the spirometer.